Well, my dear audience, I'm both a chiropractic physician and a licensed acupuncturist. 29 years as a DC, 15 as an LAC. Early in practice, I treated the typical chiropractic problems: necks, backs, headaches, low back, leg pains, whatever. But I always had an interest in looking at cancer, thinking about what could I do to help patients with it. And there really weren't anything within my arsenal that I could have at that time. A lot of years later, I got on the job training when my mom developed transitional cell carcinoma of the kidney, which metastasized to the lung within 2 years, and at 86 she passed away. In those 2 years after we found that she had cancer, though, she allowed me to treat her with anything that I thought that might help her live, survive. She was the most willing, wonderful patient that I've ever could imagine. The start of the care was with visiting Jeffrey Ewan, who's an acupuncturist and herbalist in New York City, who's world respected in both the area of Chinese medicine and Qigong. Jeffrey is also one of my teachers, so I'm very fortunate that way. He gave me treatment protocols that I could bring back here to Trenton and provide the care to my mom. I complemented that with a lot of the things that I did in my research. Things like antioxidant vitamins, SCACT, 714X, juicing, coffee enemas, just to name a few. I'm going to talk about some of those ones you're probably not familiar with in a few minutes. My mom died in 2 years, just about as long as the oncologist predicted she would, but she lived. Spent active time with her 6-year-old grandson, and less than a month before she passed, she was able to walk a mile to her sister's house at 86. She got a little winded, but what I feel is that when we look back, we did provide her a better quality of life. And she was able to die on her terms. What teacher Ewan has taught me, that sometimes the patient living is the only definition of successful care. Sometimes it's making the journey more peaceful and allowing the patient to come to terms with the completion of their lives. That becomes a success. Well, this led me to continue my investigation of how I could help cancer. Serendipity, I'm going to talk about it a couple times in the next couple of seconds. My teacher, Jeffrey, 4 months later down in Maryland, he gives a 2-3-day lecture on cancer care for Chinese medicine. I was able to attend that. And I kind of shelved, I consumed some of the information, but I really didn't put it into practice. Only until my association with Dr. Weider 6-9 months ago did I begin to actively put all this put it into gear. Serendipity. Dr. Weider and one of my employees was on jury duty together 6-9 months ago. They got to talking around the table. Oh, what do you do? What do you do? Well, Doc described the book that he did, and he made mention. He said, well, one chapter I don't have in there is a chiropractor. And Leah, my employee, said, well, I work for a chiropractor that's into all kind of integrative. So we met, and we started talking about the ideas, and that led to this evolution of this. So I guess sometimes things happen for a reason, but anyway, the journey's taken me here. Some of the areas about cancer care I'd like to talk about specifically are the first Chinese medical perspectives. See, Chinese medicine is at its core is very simple. Yin and yang and keeping it balanced. Cancer is a disease of imbalances at many levels. Genetically, environmentally, spiritually, emotionally, physically, and immune-wise. Chinese medicine helps the patient find the balance of all these factors using acupuncture, Chinese herbal medicine, Qigong, as John had previously mentioned, which is a movement therapy which balances the body and mind and strengthens and directs the Qi, the body's life force. Diet and meditation. interesting when you look at Doc Weider's approach, his book and his perspectives, and a lot of the things that Chinese medicine talks about. They're very similar in focus. Jeffrey Ewan taught me a few specific strategies in his treatment approach. First, you want to decide whether you're going to help get rid of the cancer with the patient, if the patient's strong enough, or put it into remission. Try to put it back to where it came from, literally, to allow the patient to have a sustained life, if they're not strong enough to undergo the active treatment. Specific perspectives that he talked about were vitally important. We're supporting the digestive system, making sure that we're able to consume healthy, positive food chi so that we can live in balance and fight the cancer and bring us back into that state of balance. Support elimination, so the body can, as the body processes the cancer, we can get rid of the toxins and not let that to be a problem. And right in line with Dr. Weider talks about, Chinese medicine talks about supporting the immune system. We're supporting the Wei Qi, the surface defense system we have against outside invaders, outside and internal, and help the body fight the cancer. So they tie very much in line with what's the other holistic, complementary, and alternative medical approaches that are out there. The role of the emotions that helped you create the cancer in the first place. Old emotional scars and injuries that were never resolved, allowed to go within and become cancer as we get older, and less able to keep it in remission, keep it suppressed. In Chinese medicine, we talk about specific emotions as related to organ systems, often the organs that are going to get the diseases. The kidney relates with fear, the liver relates with anger, the heart relates with joy and hate, the spleen deals with worry and overthinking. The spleen is of the earth element, Mother Earth. There's nothing that's more describes a mother than worrying about her tribe, her children, her world. And the lung, the emotion that relates with that is grief. And the picture I've always made in my mind is the old Catholic Italian funerals, where you have the old Italian lady in the back of the church that was paid to wail, to bring out the grief of this outpouring from the lungs. If one harbors worry, it can lead to the conditions such as stomach, liver, large intestine, pancreas, cancers and conditions. Anger constrains the qi, it stops it in place, keeping those things stuck in place and able to fester and become a problem. I had 2 employees that have had cancer through the years. One, God bless her, passed away about a year ago. She developed left breast cancer. Well, Marianne married the love of her life who died on her 2-3 years prior. And what's right next to your left breast is your heart. So Marianne's heart was broken is one way I can interpret and look emotionally what might have affected, what contributed to her disease. My mom, she was a single mom, not well educated, and I think fear overwhelmed her life. She often translated that into anger. And the kidney and fear are interrelated, so that was the root of what happened to her. And an employee developed uterine cancer, a young, beautiful woman. She was in a horrible, fearful for her life relationship where she developed uterine cancer. After she got rid of the relationship and had the medical procedures done, she's now healthy, working to become a nurse and moving on positively in her life. Just give a few simple examples. In the comic strip Jumpstart, one of the grisly characters is a police officer, a guy named Crunchy. For some reason, he was quoting Buddha the other day in the comic strip, very philosophically, hit me right to the core. And Buddha speaks about holding on to anger is like drinking poison and expecting the other person to die. So we're poisoning ourselves if you hold on to things, those old emotions that don't become resolved or come to peace with. Those are the emotions before the cancer. And then there's the emotions that hit us after the experience, after you have the illness. Fear being the predominant one. It freezes the works in place. It doesn't allow our body to respond to the cancer in a healthy, positive way. Both aspects, in my opinion, need to be treated. You've got to resolve the past. You've got to control and be at peace with the present and the future. Treatment approach addresses it psychologically, and it's also something that Chinese medicine does an incredibly powerful job with, particularly the body-mind reconnecting part. I'm not going to go into that. That's the lecture all in itself. Often it's not the cancer that kills the patient, but the fear that goes along with it. Doc has is a beginning handful there. John talked about a few. There are volumes of alternative cancer care around the world. What I've learned in my beginning study of it when Mom was ill was it becomes insanely overwhelming. You're dealing with an area you don't know about. It's very scientific, and it's life or death at some level. No, at its core, excuse me, not at some level. There's one very wonderful one called Curezone. I'll give it to you after, but curezone.com/cancer. It lists a lot of these cancer cures from around the world and provides a forum to learn more. I just want to bounce out a few that I'm a little bit familiar with, just as a sample. Excuse me. There's something called SEACT. It was passed on to a nurse named Renee Cassier up in Canada by, I don't remember the Indian tribe, but it was a traditional herbal remedy that they were giving to patients, to sick Indian families and patients, that worked successfully. Passed it on to Nurse Cassier, who started using it in practice. Canadian Medical Society and ultimately squashed her, but that therapy has been found profoundly useful in certain aspects of cancer, primarily spleen and digestive related. Before I mention something called 714X. It's a therapy out of Canada, ironically. It's a biomolecular therapy that works at a submicroscopic level to treat we almost talk about them as some sort of bacterial-like particles within the bloodstream that you can't barely see. You can only see with dark field microscopy. But it's the treatment of those that have been found to be successful of the cancer with a chemical compound. Again, I'm not giving you the technical details. Juicing, a profoundly valuable way to get those positive nutrients in our system that we need to fight the illness. Max Gerson out in California put together a whole alternative cancer program, 30 years ago, Doc? You're familiar with Max Gerson or a little bit? Okay. Madame Gualin's on my list, with her Qigong, very specifically focused toward treating the cancer from a medical way. Meditation. Again, all areas that we've briefly touched on today a little bit. Simply, it will take a life effort. Integrate a plan that's right for you. Take an active, make a difference role in your survival. I'll talk about that in a second. These are all the roles that I provide in practice for patients with cancer. Chinese medical aspect, Chinese medicine, and acupuncture, and Chinese herbs. Supporting the emotional, and acting as a teacher, complementary and alternative medical teacher and guide. An example, much like Dr. Leader and I have provided for John and helped and guide him along the path. I want to develop to do that in a much more comprehensive, effective way. I want to end with an editorial that kind of a disturbing thing. You have the perfect T-shirt for my editorial. There are umpteen walks that are done for breast cancer and prostate cancer and all these wonderful benefits that are going to raise money for Western medical research in a lot of cases and to support the patients. Rarely do I ever hear about them raising money for alternative research or possibly for patients with cancer that can't afford it, or for providing something other than a pat on the shoulder to the patient and saying, it's going to be okay, I got your back. Absolutely vital. But it doesn't give the patient anything to go home with and say, okay, this is the nutrition that I need, this is the emotional changes that I need in my life, this is the exercise that I need to be doing, this is the changes I need to make. The walks are a passive, beautiful, wonderful gesture, but the care needs to be active at the role of both the physician and the patient. Stop. I'd like to open it to questions and thoughts.